Saints. So today is February 1st and I'm starting a new series called Heart of a Saint. So Heart of a Saint is a series where I tell you all about what it's like to be an adult with TOF, also known as ACHD. Why did I have a hard time saying that? It's also American Heart Association Month. So what is that? American Heart Association Month is a month dedicated to people who live and survive or are dealing with heart conditions. So we're going to get into the meat and potatoes, and I'm going to explain what all of that means. So people with ACDH are born with a congenital heart condition, and it's not something that you develop over time in comparison to people who develop heart conditions later on in life. So my condition specifically is called TOF, also known as Tetralogy of Fallot, also known as blue baby syndrome. What are symptoms of ACDH? Fatigue, shortness of breath. I have numbing in my hands, legs. Sometimes I get palpitations. Sometimes I have flare-ups, which aren't always the best feeling in the world. And I'm going to show you what it's like to be an adult with ACDH, also TOF, because I feel like there's not enough light that is shed to my heart condition, or not enough, I don't want to say research, but I'm going to bring more awareness to it. What is TOF? TOF, or Tetralogy of Fallot, is a combination of 4 different heart defects that are present during birth. So the first one is pulmonary stenosis. The second one is a ventricle septo, or VSD. The third one is an overriding aorta, and the fourth one is enlargement of the right ventricle. What causes TOF? So in my case, we really don't know, because my mom is extremely healthy. She doesn't take medication, she doesn't smoke. I don't have a family history of congenital heart disease. My mom didn't have diabetes while pregnant or rubella, so it's kind of a mystery on how I developed my condition. Now, as I stated, everyone's different. Things that can cause TOF during pregnancy is smoking, taking certain medications, having a family history of it, or developing diabetes or rubella during pregnancy. I know I said a lot. So what does all of this mean? These defects, the 4 defects that are present during birth, change how bloods flow through the heart and the lungs. So people with TOF, like me, we have lower oxygen levels in our bodies. So things that I've noticed are, like I stated before, numbing in my hands and legs at times. It's a lot harder for me to do certain things. I get short of breath really quick. But something that I use to help me with my shortness of breath is this little tool right here. So I use this because it helps me break on my breathing, and it also helps with my lungs. So yeah. And I don't know if you guys can see, but I have this really cool scar. Yeah, I have this one here, I have another one right here, and I have several on my stomach from drainage. What surgeries have I had? I had corrective surgery at birth. I also had corrective surgery in 2007, another open heart surgery. So I have 2 scars. It looks like 1, but it's actually 2. And then I've had like catheterizations over the years, and then in 2000 I had another surgery, but it wasn't an open heart surgery. I had a valve replacement where they went through the groin with like a really long string and like inserted a stent. It's kind of cool. I'll probably post a video. So blood clots, which is why I take aspirin every day. Abnormal heart rhythm. So my heart rhythm sounds a lot different from most people. Kind of sounds cool. It's really easy for me to get an infection in the lining of my heart. So something as simple as going to a dentist appointment, I would have to take antibiotics before my visit, or if I was to get a cut, a bruise, I would have to be very, very careful, because those infections, if it does get infected, it can go straight to the lining of my heart, and that's not a good thing. Leakage. So leakage from the repaired valve. So back in 2021, I was in Mexico and I got really sick, but I didn't know why I was sick. And as soon as I got back home, I went to my cardiologist and I found out that I was having leakage in my valve, which led to me getting corrective surgery or valve replacement in 2022. How am I? I'm thriving. I'm the healthiest I could be. Some days are hard, but for the most part, I'm a normal 20-something-year-old. So I feel like that's the best part of all of this. Like, don't know how we look. I feel like a lot of people would see me and not know I have heart condition, unless they see like my scar or something. But I do want to say, like, we're normal. We can do pretty much everything you can do. We don't have any limits. And for me, I think I'm looking for my community, because it's also spreading awareness and showing people that what you think heart disease look like isn't what it actually looks like. Because I would tell people, like, yeah, I've had a valve replacement, or I speak to someone and they're like, well, are you like 50, 60? Why did you have that? What was going on? And it's like, no, I was born with it. That's the purpose of the series. So I hope you guys are ready to join me and have fun this month. We're gonna spread